Welcome to today's webinar, which is sponsored by the National Alliance to End Homelessness. Today's subject is calculating change, the continuing conversation on data reform. We will be discussing some recent recommendations made by the National Alliance to End Homelessness in this area. And today I am happy to be joined by two distinguished guests in this space. The first being Dennis Culhane, who is a professor at the University of Pennsylvania. And the second is Cherkole King, who is the Director of Database Management Solutions for ViaLink. And I should mention who I am. I am Joy Moses. I work with the Research and Evidence Department at the National Alliance to End Homelessness. So I'm just going to go ahead and get us started as I think of the folks entering the room is flowing a little bit. So I'm just going to go ahead and get us started on some background about this project. We can skip that. So we at the Alliance have been hearing a lot from the field and from different partners about various ideas related to data. And we divided them into two categories, basically how data is collected and how data is reported. We were interested in all the chatter and all the conversations, so we wanted to formalize a way of formalize the conversation, formalize a way of managing some of the conversation and organize some of the thoughts for our purposes so that we could hopefully contribute to the conversation in the field. In order to do that, we held conversations about different thoughts that people had about data reform in various forums. We reached out to partner organizations. We had a big forum at our national conference in DC. We also spoke to our different work groups, and then we did a round of Zoom-based open forums. We reached out to our listserv and asked folks to just drop in and join and talk to us, and we heard interesting things that way and met a lot of new friends through that process as well. So what we arrived at was a list of ideas that were suggested to us that we heard and that we added to and that we reformulated and kept going. It kept in a feedback loop of conversations with the field. And we emerged with two goals in mind. The first being informing improvements to service delivery. So reforms it would be great if reforms were able to accomplish that. A second thing that it would be helpful for reforms to accomplish would be to shed light on resource gaps, essentially informing policy. We view this as an ongoing conversation. I want to stress that greatly because as we started to delve into this space, we realized that there were a number of cans of worms that we could unpack and continue to discuss, and that could lead to further reform ideas or deeper questions, et cetera. So although we ultimately hit a stopping point and put out a publication, we recognized that that there was more to be said and that there would necessarily be more to follow. I wanted to highlight some of the areas that came up for us and that we decided to ultimately highlight. The first being democratizing access to data. Making sure that more people are able to know what people who work in HMIS and who regularly are looking at data on a daily basis, what they see and what can be garnered from that information and material. So this can be divided into two separate categories. The first being making data and data analysis public facing and publicly available. The goal here would be to foster collaboration amongst people who work in homeless services. So beyond the COC, there's so many different nonprofits and agencies and so forth that serve the population, and it would be helpful if more of them had easy access to data about people experiencing homelessness. And of course, it enhances research. To get to that goal of making information more publicly available, the report talks about making the information in Stella P public facing within communities and encouraging and supporting community specific dashboards. Another area that we heard about was easing client access to their own case files. There was some strong feelings that this type of democratization of data could help build trust between clients and systems, could help correct inaccuracies in our data files, and it could help in sharing information with clients about things like appointments or housing opportunities, et cetera. Some communities have been implementing these types of access methods. One thing we heard about was the use of phone apps that would allow clients to see what systems have, what information systems have about them. Another area that we identified was identifying and responding to challenges. How can we make sure that at the national level there's more data available and data available for analysis that helps to identify problems more quickly and I should say challenges more quickly so that they can be addressed. So if unsheltered homelessness has a spike, we could see it early. If certain subpopulations are particularly struggling or entering homelessness at high rates, how can we see that information as quickly as possible and therefore be able to respond to it and hopefully mobilize federal resources where they're needed. A big idea under that category was to start transferring client level data into a national level database that's would allow for greater analysis. Essentially, instead of having communities share aggregate data, they would send data in on about each individual client, which would allow for greater and deeper analysis at levels above the local level. It would allow for things like deeper analysis of demographic data, looking at the intersections of identities. So basically, right now, because we look at aggregate data at the national level, if we wanted to look at, because we look at aggregate data at the national level, we have defined buckets that we are examining from one year to the next, but an intersectional analysis would allow for more complex looks at identities. So instead of looking at men separately and Latino separately, we would be able to look at data for Latino men and maybe even Latino men who are older adults. So we could dig into more complex of intersections of identity. There also was some conversation about ensuring that more communities are able to share and post data and analysis more than once a year as a part of the AHAR process, but maybe on a quarterly or monthly basis. Many communities are doing that, but how do we support more to be able to do it? We have been a part of a number of conversations about the workforce in homeless services and the challenges that are arising or have long existed in that space. So that we heard suggestions about collecting workforce data and making that available as well. And that could could take various forms. We might want to collect data, for instance, on staffing ratios, average tenure of some of our staff, so that we can know and understand how the workforce is impacting our capacity to serve people experiencing homelessness. I want to get into the conversation, but I'm going to go over a couple of more things. We heard a couple of group specific ideas. I'll highlight two separate demographic groups. One is older adults. Definitely because of the growth in this population, people wanted to see more data about them and more focused data. Again, we had discussions about intersectional information. Instead of just seeing data on people over X age, there was a interest in seeing data about Latino older adults or women who are older adults, and that requires some intersectional data that we currently don't have available at the national level. And then there was some interest in any type of data or information that we could collect that would give an indication of the service needs of the folks being served. And a big example that arose from those conversations was collecting data on activities for daily living, the activities of daily living, and how could we incorporate that into our service models. Also, the field has been very focused on how we understand the challenges facing people of color, and data for the various groups So similarly, some focus reporting, intersectional data, but things like regional and geographic based data as well. And I'll highlight a couple of other ideas that came up. One, how could we learn more about qualitative data collection? How can communities work together to pool and share information or develop best practices? And by qualitative data, I mean interviews and surveys, so that we have information beyond how you would check off a box about the person as for the various characteristics that they possess. But how do we learn more about them and their experiences with homelessness from actual deeper information? And then finding ways to expand the way we're reporting on system capacity. How many shelter beds do we have compared to how many people who need them? Those types of things. And then various forms of data sharing across homeless service systems, but also with other systems. How can the federal government better support those efforts? And I'll mention a fourth one, expanding supports for improving data quality that's happening at the local level. And one thing we heard time and time again, which is the last one I'll mention, and a very important one, we understand greatly how people feel about this, but funding. There are a lot of ideas out there for how we can improve our data work, but they all cost money, and that is something that is a concern, obviously, for cash-strapped systems who are trying to do a lot with little, and we recognize that. So I am going to stop there and start a conversation with our panelists, Shercole and Dennis. Would you like to offer any initial impressions of some of these recommendations?
I'll go first. First off, congratulations on creating yet another wonderful document, giving actionable ideas from different communities. Some of the things that first stuck out to me about it was the thing that hit me the most with this document was all of the great extra things we can do. But the reality is many of the COCs don't have the privilege. And, you touched on that about the funding. They don't have the money, the resources, the capacity to make some of these things happen. And it's just been playing in my head of how we can get to a place where we all have the capacity to make meaningful, equitable changes beneficial to the clients as well as the staff. The other thing that kind of I thought about a lot initially was about what stood out was the discussion on the workforce, specifically about your 2021 survey discussing the significance of job vacancies, as well as us starting to look at the actual workforce data so we can start having a level playing field of exactly what is the reality of our workforce within human services and how we can expand and actually help the people working in these areas to be able to help the clients more effectively.
Great, I agree with that, and I would just want to amplify a few points that I think are in the mentioned, but which I think could be featured a little more prominently in our thinking and conversation today. One is that certainly we need to be using these data much more. So much effort is spent collecting this data, not just by the agencies, but by the clients in terms of all this information they provide. We've got to better use it. One of the key purposes I think that we need to focus on is advocacy. We use the PIT count, I think, only to usually indicate, is homelessness going up or is it going down? And, really most of the time when it's going up, in the places where it's going up around the country that I see, it's mostly driven not by more people coming into the system, but by fewer people are exiting, and length of stays are going up in many places around the country. So we got to kind of like use the PIT to change the narrative, because yes, we want to be able to promote that homeless service systems are doing a good job and the things that they are doing, but we don't want to deceive people that we actually have the capacity to solve this problem. And we need to use the PIT in combination with the information we know about exits, people are going into what slots, to be able to talk about the lack of capacity. And, yes, we want to promote housing first as a right solution, but that's aspirational. Most people get shelter first and shelter only. They never get to housing first. So yeah, we want to get to that place, but we have to be honest and communicate to the public and use the data to show how we are underserving so many people, that half the adults can't even get into a shelter, let alone the conditions of those shelters. So that's one. The second, to your point about having clients get access to the data, I think we should be thinking much more about a two-way flow of data between clients and between the coordination systems. Using it for client engagement, to reach out to clients, to check in with them, have an opportunity to have them have voice and talk about what's happening, help them track application issues like SSI, or housing applications, and coordinating when they're going to be able to go to appointments and such. And even embedding little surveys, where if an issue's coming up, we want to do a quick survey of what's happening. We would have a way of communicating with people and getting feedback. So I think that's another thing that could be done. Just a third part about the analysis, you talked about being able with client level data to drill down to more subgroups, but also that we want to keep in mind longitudinal analysis is really the key. That's the real power, I think, that's been undervalued as well. Again, emphasizing the PIT over the annual data, which the annual data really can provide a much richer picture of what's going on. And lastly, I would just mention that with regard to the HIC, some of your recommendations about staffing and issues about agency characteristics like that, perhaps the HIC could be used to leverage as a data collection tool more about the workforce, more about the agencies and their financial health and needs, et cetera. So those are just a few suggestions, but I really appreciate the effort and what's been done.
Yeah, just a few suggestions, which is good. It's good to, and again, some cans of worms opening, but these are conversations that we should be having and continuing. I just want to make a note. If you have questions, we will be taking them towards the end. So please put them in the Q&A box. And also, many of you have found the chat, so please continue to use that space to chat with one another, and check in with one another. So we're just going to continue the conversation. And so I have a question for Shakol. One of the things that we highlighted was making more information publicly available within communities. I know you regularly work with HMIS, and you also are network quite frequently with other people who work in HMIS. What do you make of these suggestions for taking more of that data that you all see as HMIS folks, and having more of us see it, having people see what's in Stella P, et cetera?
Something that was stated in a document that brings this all together to me is first that the goal should be how we advance our bottom lines. The data could be used by everyone, so that the data should be used by everyone in the community. And in many COCs, there are groups who don't understand the data or have never seen it. And I think that's a big, like, we're all under the consumption that everyone in your continuum have seen the data or even understanding, and that is not happening in a lot of communities around the country. How we fully create invested ecosystems without the data being readily available in digestible ways should be the question we are asking ourselves first. When we're working in a fully equitable system, this should be a right for us to start thinking about how we're making this digestible. I think one of the great steps that HUD did take was the development of Stella P. I love Stella P because first, many of the communities don't have those resources nor capacity to visualize data in this way. So having this tool has definitely helped many communities see their data differently, as well as visualize and begin thinking of like new solutions or things that they can start small and start doing themselves for their community. This first step is like helping communities begin to understand that it's important to not only collect the data, analyze the data, but know what is important to tell the story of the data too. Start to create more full buy-in to ending homelessness for each community must understand the state of homelessness in each community. It must understand the state of homelessness, and it can only be done by creating creative ways to advocate for the communities we serve by developing public-facing showcases of the data. One of the barriers I see in sharing data could be simple as each local departments or the agencies may not collect data in the same way. So when we're starting to bring those things together, that is one of the issues that we can see. The same goes with demographics may not be used in the same way when we start connecting those different agencies into this. So we need to start doing things to review the data over different lines where we need a level starting point on how to connect all of the data from the different sources, and that can become a problem within its own different communities as itself. Cultural competency in data collection is a big thing for me, especially lately, where we've been focusing on, especially in my community. Each community partner can collect data in certain ways that does not take into account the cultural differences, which could skew the data based on a community, different groups being, involved in how you're sharing data in publicly. So understanding how everyone in the community is taking the data and understanding the data, even how they are working with the clients with the data, is like one of the first steps we can do to continue to move the data to go public facing. But I think everyone is starting to think more outside of the box of how we can make everything actionable, how we can start moving forward, just start thinking outside the box. But we have to remember that we're all doing it so differently. And we need to figure out how we can bring this all together and tell a story, because not everybody understands it. And I think that's the thing that worries me the most, is that we just expect people to understand data or understand how to publicly share data when it's not a reality for many communities right now.
Do you think people are afraid of what happens when people don't understand the data?
That's one of the reasons. Yeah, some people are more afraid of what happens when they do understand the data as well as when they don't understand the data.
That's true.
I think that's a reality in both of those ways. Yeah, and someone has said in the comments, the staff needs to understand the why. I think that's the big part of it, is that a lot of people don't understand the why of what's going on in the community, not the overall of ending homelessness, but what is the why in this moment? How are we going to get to our next actionable step to continue on this specific fight, and how are we going to tell this to the public to get them more invested?
So I want to turn to another area of recommendations, which is the client level data. The notion of communities transferring client level data to some sort of national level warehouse and the potential of that. I think I kind of glossed over, but I think it's a pretty powerful change. A lot could come from a change like that. I wondered, Dennis, if you could talk a little bit more about that, because the Alliance in this report is definitely not the first time this has come up. And there's a long history of this conversation. So I wanted to get your insights on the history of the conversation and where we are today and maybe where we should go next on that.
Yeah, I mean, people may recall it when the very beginning legislation around HMIS, there was a very specific language that HUD would not be creating a national database of people who are homeless. There's historically been some of the providers have concerns about government overreach and invasion of privacy, dealing with very vulnerable folks. And so there's a whole interest in protecting people's information. But I think as we've evolved in our notions about how to do data security, how to do privacy protecting technologies where data are essentially anonymized, that's come a long way. So I think that's partly why the feasibility looks much better. I still think that there's going to be pushback from communities about having others using their client level data and potentially concerned about it. So I think we have to think incrementally in how this could be done. But one possible way is that communities can archive or update frequently an archive of their client level data that has been de-identified in terms of names and certain characteristics. And then there can be tools designed by whoever's maintaining, storing this data that would make it very easy for communities to interact with their data. But there's probably going to have to be some protections like password, who gets access to the data. It might be only the agencies or designated individuals who get access. You might not be able to see other communities' data unless you got permission to do so. I mean, there would have to probably be a set of controls around this that essentially, because remember, communities own their data. Individuals, some would argue, the individuals in the data own their data. So it just can't be given away in that way. And so it leads me to also just raise the issue that we need to think about data governance, and that a lot of the things that you were making, Joy, in the presentation really call out a need that communities do have to have data governance, which means a formal process where people are sitting around a table deliberatively, including clients and community members and advocates and others who are making decisions about what's the purpose and value of these data. How do we make sure that it's used to maximum impact for these clients, but also making sure people's information is secure and protected. So there needs to be a really explicit conversation and then a process where people can make decisions about these things so that it doesn't just linger, but there's actually a schedule of meetings, there's agendas, there are items to be decided, proposals can come forth for information, they can be processed, they can be executed. So in order to make the data usable, there has to be a pathway for getting to that use. And that pathway is data governance. So I think it's a critical ingredient that has to sort of be raised in this context as well.
Yeah, and as I listened to you speak, I realized that I may have been going a little quickly through the points. And so our suggestion was not just to jump into into transferring data, but for there to be some reasonable discussions and reasonable efforts to kind of think through a lot of the issues that Dennis mentioned at both the national level, but the local level. So I wanted to make sure that was clear, that we are also supportive of the type of deliberation that Dennis just described. So I'm gonna ask Shercole a different question. We talked a little bit in our materials about race and gender data, mainly race data, and like how we could get better more information in that space, more enhanced information about various groups that are often the focus of concern for people who are working in homelessness. I know that you have served on various committees of different sorts, thinking about these issues, and you've thought about these issues for on behalf of your community as well. I wonder if you had any specific thoughts in that space.
I was actually glad y'all included that because we can't forget the equity conversation when dealing with data in any way. It's important that we continue being uncomfortable and moving forward to make those changes. Kind of like what Dennis was saying, we need of us implementing, which a lot of communities are doing more of implementing, like people with lived experience in all aspects of the data and data governance. I think one of the things we forget in these conversations is equity must be extended to the staff as well. One of the things we've been doing in our community is making sure we start asking the questions of how can we ensure equitable pay, and how are the staff getting the tools to excel and advance their careers? Are spaces being available for them to be comfortable to speak, have their ideas listened to, provide opportunities for them to grow, as well as learn more about themselves and help them to do the work further. I think when we've been doing a lot of the conversations so far, we focus just on the client side, but we have to make sure that the staff is living and having a equitable situation going on in their community for them to properly be able to help everyone else. And I think we kind of miss that a lot. We are not centering, and y'all kind of brought that up a lot with the workforce. We need to center the staff in the equity discussion. I think we forget about that. To successfully end homelessness and work with clients, we have to look at the totality of the situation and start prioritizing those equity staff and equity. I think, like, as far as with the continuing to aim the intersectional data, it's important and it matters, and it helps tell the story of homelessness from different communities, because your recommendations highlighted something that is key to me and truly understanding the community. It was resources highlighting community specific histories of influence of race on housing opportunities, and the resources highlighting the current race related housing situation in communities across the country. We do not live in a one size fit all community. So we shouldn't expect our solutions to be one size fit all as well. So we have to get creative and innovative. And one of the ways for us to help us start thinking outside of the box is understanding the realities of our specific communities, the history and how that plays into everything that affects the community as well as a whole, as through poverty, as well as in homelessness. With intersectional data, like one thing, a good example in my community that we've been focusing on is specifically what does specifically for Black women in New Orleans, what does family conflict mean for that specific group? Because that has been something we've been looking at, because it could be a completely different definition than what it means for another segment or race or gender. So thinking about those things and starting looking at the stories in an intersectional way has been helpful, and it helps many communities start really getting the full picture. In addition, analyzing the intersections of identity can help us just understand some of the hard truths about our community as well, and it help us start thinking and being the solution ourselves. So it's a lot of things in our community. We've been just trying to think outside the box and try to go to the next of, well, why this is, and what is specifically how everyone is being affected, and that being a focus now specifically in a lot of the human services data is definitely helpful, and we should continue focusing on intersectional.
Well, I appreciate that example. That was very helpful, and it's interesting that you are doing that work. It's a powerful example of the usefulness of intersectional data. So I'm going to ask Dennis a different question. Although, Dennis, if either of you have comments on some of the other questions that I've directed towards the fellow panelists, please jump in. So if you have thoughts on the equity data, please share that, Dennis. But I also was curious if you had any additional thoughts about what we're reporting in the AHAR and how it could help, how we can make changes there, that reflect a capacity to serve. I think you touched on this a little bit earlier in the first question, but if you wanted to say anything more about that, and then beyond that, what do you think about qualitative data? And is that like even a feasible possibility for us to be looking at as an additional data element?
Sure. The first thing is I just put into the chat a link to aisp.upenn.edu. It's a center that I direct, and we have a lot of resources there on how to center race equity in the administrative data process, collecting, analyzing, and using the data, and engagement with the community as part of that process. So please avail yourself of those resources. Yeah, the AHAR, unfortunately, is just, it's such a static system that we really need to, as you're suggesting, go beyond that, have much more ability to interact with even the tables that exist than some of the data underlying those tables at a national level. So I think much could be improved thinking more electronically than for a paper report. So I think that's good advice that had come from the report itself. And certainly, as with the aging of the population, we just haven't had the right level detail of aggregation of different race, gender, age groups to see, where the vulnerabilities are greatest. And we know that there are definite subgroups of women, for example, in youth. And there's the aged who are, susceptible to very different circumstances and needs and vulnerabilities. So I think that's very useful. Qualitative data, absolutely. I think in much like Shakol was talking about how, in using the data and understanding the data as part of a sort of human resources quality improvement, getting people skills which they can use beyond this job and thinking about their next job. But similarly, qualitative data is pretty essential to understanding what's going on. And, it's not that hard for people to put together focus groups, to have structured opportunities to get client input. I think that the challenge sometimes is that we treat client representation, let's say on a board, a person with lived experience or a couple people, as though that's really going to address this issue. Whereas we really should think, from a researcher perspective, having structured opportunities for people to discuss and comment about what's happening to them, about what's happening in the system. And some of it's going to be very critical of what we do. And we can't be afraid of that. We have to hear what people are saying, understand the experiences that they're having that are negatively impacting them, even if it's in our own, programs. So it's something that we should be doing. We should be thinking systematically about it, how to have routine, ongoing ways of getting client input in a way that is qualitative and reflects their voice and view. And it goes beyond just having a person with lived experience on some board or a committee. So thank you.
Yeah. Very important. Sounds like if we could do that, that's a game changer. I want to bring up another thing that has been raised for us as a game changer. As we went through a process of thinking about all the possibilities of things that we could have be a part of this conversation, we did hear feedback that the biggest thing that you could do is to make sure that we enhance data quality at the local level. The degree to which we have accuracy in ways that people are entering information and processing information at the very front door of our systems. I get that and appreciate that. I was wondering if maybe Shakol, do you want to say anything about that piece of this work?
So for me, the main thing that I think about when we're thinking about data quality and data collection to start making strides in that is we have to focus more on the data collection side of exactly how exactly do we collect this data? Is the first question that we, as a community member should be asking. Are we providing the level setting and basic understanding to case managers on things such as what is gender and race diversity, to offer up the element of creating, safe spaces for individuals to share that type of personal information. That just as an example, asking the communities of what is my community doing to center people in every aspect of the data collection. I think the one thing when we think about data collection, we just think about, well, this is the percentage of completeness or but we're not looking at exactly how we're collecting the data and getting this data and how that is going to make for the most effective data. And we leave that out of the conversation so much. We just don't take enough time to stop and reflect and figure out what's the best collection phase for all of the clients as well as the staff to make, the best decisions on behalf of those clients. All communities will be different and have those conversations in different ways. But we have to take a look and ask these questions and ask how to ask these questions is important. We got to know how we're asking these questions and how to ask it specifically for your community. Because how we would ask the question in New Orleans is probably not going to be how we ask the question in Georgia or some, wherever else. So just understanding how we're doing it is the first step to me to focusing more on data quality, because data quality to me is all about what are we getting at the data, what are we getting at the data collection phase, at the entry phase of the process.
So we are getting a lot of great questions in the Q&A. I want to turn to those, but I'm actually going to I'm just going to ask one other additional moderator question, which is I'm going to acknowledge is a big one that we could spend hours talking about, but it also is something that comes up quite a bit, which is sharing data across systems, across homeless services systems, but also data integration across with other systems like healthcare, et cetera. There are a lot of folks who are interested in this space. Do you care to offer up some thoughts? I know this is a big one, and like I said, we could spend a lot of time talking about it, but some initial overarching thoughts, and then I'll turn to the audience questions.
Sure. I think that the technology that makes it possible through APIs to share limited bits of information from the homeless assistance programs with your local HIE, your health information exchange. So most communities have a health information exchange where hospitals and insurers, et cetera, can share information about clinical appointments and test results, et cetera. Now, there are lots of gates that are kept in terms of who gets to see what, but some communities have successfully, built some APIs for their homeless data so that the HMIS, some pieces of HMIS data and healthcare data can be seen by case managers who are authorized to see that client level information. Where is a client? When do they have an appointment? When's there going to be a follow-up, and vice versa. So I think that's something that we absolutely should be thinking. And I don't think it's nearly expensive or complicated as it once was. But again, it does raise the issue about data governance, right? You can't just make these steps and go forward with this without having a real conversation with the community, with the stakeholders about how people's data will be used. What are they going to be? What's the acceptable uses? What's the mission and purpose? And how's it going to be done? So that is, again, I think going to be an issue that gets added. But going further than that, the other big issue is sharing data for analysis and research purposes. This has been going on for years. It was one of the reasons that the HMIS legislation was originally passed, was to understand how mainstream systems, child welfare, corrections, substance abuse treatment, et cetera, are contributing to the homelessness problem, sending people into the system, how the homeless system is then impacting these other systems as well. So that kind of analysis has proven very rich and has been used in a lot of communities for advocacy to show that, this is not just an isolated population that's in this quote unquote homeless assistance system. These are people who are embedded in all of these other programs and schools. And we really need to understand where to better serve people in these other programs, prevent their homelessness, leverage the resources in those systems to work on behalf of this. So if we don't have those data points, we're driving blind. You know, we just can't, if you don't see them, you can't do anything about it. So, and again, that's a data governance issue, because someone has to decide that, as the owners of these data, that sharing data for those purposes is serving a legitimate, important, client-focused purpose.
And I'm actually 100% with Dennis. I'm all for sharing data between homeless services and other systems. You can ask my boss, Clifton Harris. I am obsessed with finding a way to make reentry data and homeless data work. But like Dennis said, the big issue is, how does data governance play into this, and how we're going to work with the community to make these system changes and create triage tools to work throughout all of those systems. I mean, it's the big thing. It's about how exactly all the communities are going, how the organizations in the community are going to actually work together to make this happen. So the whole collaboration and understanding how we're going to get to the next step is really the key to making some of these type of systems work and sharing.
Right, as promised, I'm going to go to some of the audience questions. The first one is a little bit critical, but that's okay. It's basically that the person likes making the information more accessible. But truthfully, we do already collect a lot of data already. How can this extra data be used to help people out of homelessness quickly? So I'll open it up.
For me, as far as information and the data that we're collecting, I do think we are collecting a lot. I don't actually promote any additional extra data for this. There's so much data that we're already collecting that if we just take the time to use it and use it effectively, and then actually do, like Dennis was saying, bring in more qualitative based around it. So like if you're asking a specific question and you're getting a response of, like, let's say 25% of Black female are doing such and such, taking that a step further from off of what are you doing, and then potentially go into a qualitative where we're looking at focus groups and different systems. I don't actually think we need to go to a point where we're asking specifically for too much extra data, because we are asking a lot of clients, as well as we're asking a lot of staff.
Yeah, and I think that it's in the chat as well. The concept of progressive engagement is that, you know, why dive into some big assessment on day one with the client and asking all these personal questions about their health and disabilities when you're not going to do anything about it? You know, ask the questions at a relevant point in time when you are actually in a position to provide support to a person. So what do we need to know when a person shows up? Like, do they have an emergency medical condition that has to be addressed? Do they have an accommodation need that has to be addressed? You know, and who are you? And, you know, a quick understanding of what needs to be done with the person on day one. But collecting the data as it goes along, as we need to know. Ask when you need to know, not necessarily just to have information that we never use. So I think that's being intentional about what is collected when. And it really does go to this issue of the assessment process, and you know, which is a process. It's not just an assessment tool. We shouldn't, I think, be thinking about that. And you know, yeah, we call it coordinated entry, but it's really coordinated scarcity. We don't have these resources. So talking about, oh, we're going to do this because we're going to get you into a program. Well, but you're not. You know, at best, 20% of the folks are going to get into a housing exit program. So in most communities anyway. So I think that we have to think about what we're doing, when and why, as part of this process.
Yeah, and we're definitely all in for the idea that we should not be overburdening people with more and more questions. Definitely we would not suggest moving in that direction, but as Nicole pointed out, there is value in rethinking how you're analyzing the data that you are already collecting. And thanks for all of the above comments. We had another question. Has HUD shared what the barriers are to making Stella P accessible to more than just HMIS admin COC leads, even just allowing COCs to give access to folks. I can say that there are some barriers there and some technical things that would have to be worked out. And it's not a small thing. It's something that would take some time, and that it is a very real part of this process. So that was a very insightful question, and that is a piece of this puzzle, is making the resource investment into changing the system so that it can be accessible in that way, but also putting in the human resources. But I guess we argue that there's a value in doing that. I have a question from Diana. In terms of group-specific data, what about children? The data available are notably poor and scarce, especially for children under age 5. I think we can do better regarding metrics. In New York City, certain data sets are unavailable to the public, so we don't know what data are being collected around migrants experiencing homelessness, et cetera. So this is a very good question. What about the other groups that I did not mention? Do either of you have thoughts that you would want to share on those?
I think with regard to the migrant issue, it's important for us to document what proportion of people coming in are coming as part of this migrant crisis. We've always had migrants in shelters. That's always been true. But we've never had a systematic referral and delivery of people from one state to other states and cities. And it's going to really affect the homeless numbers next year. And, you look at New York City's like a 50% increase in sheltered homelessness in just over a several month period. And being 15% of the national homeless overall, that means we're going to see a 7.5% increase in homelessness over the whole United States next year. So we need to be able to distinguish how much of that is happening with the migrant crisis versus not. So, because not every community homeless people are going to the homeless assistance program. They have refugee resettlement and other kind of migrant programs. So it's something that, we have to be measuring. So that's just one thing that you mentioned that I would just chime in on.
I can go to another question. Is NAEH planning to do any pilots around these recommendations? That is a good suggestion. I will raise that for my boss, but I will say not at the moment. We don't have any immediate plans for that, but thank you for that suggestion. Let's see. I find that politics and money to date can drive decisions in my local COC more than the data. So how do you suggest we push for this from the service provider level? So this is a question from Barbara. Yeah. Do you have any thoughts on her question about the politics related to these issues and what you could do at the service provider level?
Overall, that's a tough one. It's 100% tough because that's a reality in many communities. One of the things that, it's the most basic of them is just advocating for yourself and for your agency and your community. At your service provider meetings, at the different local community meetings, or however your homeless service providers are working, and being able to speak up and on behalf of your community, to those constituents that are in that area, however the politics are playing in. That's really a tough one, but yeah, that's been one of the main things is, even though it's scary, just being able to speak out about what I believe is necessary for our community, or for whatever's going on, and just saying what needs to be said, even though sometimes it can be a very scary thing to advocate for yourself and for your community.
So I have a question from Augustine. on, I think, one of Dennis's favorite topics, data governance. It's an important dimension of the conversation that needs to be better understood and supported. Do you have suggestions for how to introduce data governance to continuums of care?
Yes. And again, I would just refer, I put that link in there, aisp.upenn.edu. We have a lot of resources there that are developed and targeted toward community members to understand what it is, how you put it together. We have some templates of things. I've suggested over the last couple of years and have had really good dialogue with HUD about this, that maybe we should create a customized resource guide for communities on how to do data governance with HMIS specifically, so that it's not just because the guidance on our site deals with health and human services writ broadly. But I think we could come up with a customized set of guidance for communities, because it's not that difficult to do. But it's all about the people. It's not a technology issue, and it has to be done thoughtfully and inclusively, and so glad to be able to get more guidance out there.
And I'm going to do one more question from Jonathan. There's a growing emphasis on integrating HMIS data with other local administrative data. Can you speak to the potential here to inform our strategizing and the difference it might make to have this other data integrated that goes beyond like self-reported data in HMIS? So essentially, what is the value of integration across systems?
I've spent 30 years doing research just using that methodology. So for me, I really see immense value. Linking these data helps us to better understand the person, what circumstances they're facing, how agencies are or are not being responsive to them and addressing their needs, where the gaps are. And we really, the homeless assistance systems are tiny relative to these big government programs like child welfare or criminal justice and et cetera. So we need to be able to speak truth to power in those agencies and be able to call them out on how they're playing a role here and what they need to step up in terms of their responsibility. So I see it as driving greater accountability on behalf of people who are, they're falling through the cracks because we make those cracks. Those cracks are there. They didn't just appear. And so we have to be using the data to force those hard conversations locally. And, we have to admit we're weak, but we can get advocates and allies and people who do want to see those programs improve. And we can be part of that, because we need to say, hey, listen, when 15% of your clients are coming into the homeless assistance programs, that's wrong. Okay, what are you doing about that? What could we do better? And I think that's the kind of conversation we want to drive.
And I agree with Dennis. It's just all about the complexities of understanding the complexities of life in your specific community, because it helps us to realize that there's no one size fit all for everyone, and your community is different from another, and it'll help you start being creative and getting more innovative in how you actually go about ending the crises that are going on.
So we have about a minute. And we touched on so many different topics. Is there one additional topic that we didn't get to today that you think should be a part of future conversations and future work around data reform?
If I had one dream, I would say everyone should collect prior address information. Where did you live before you came into homelessness? Because if this is a housing problem, if this is a problem coming from communities and neighborhoods, we need to know what is the nature of those housing problems, the housing, the neighborhoods, what's going on. Prevention, going further upstream, is going to be community-based work, and we need to know where people come from. So let's collect at least just one little piece of information: is what's the most recent relevant address for you?
Any last word, Chicole?
For me, it's just providing basic access to understanding data for community members, the staff, clients, and everyone. Just having a basic understanding, providing opportunities to teach those individuals how to actually read and understand data, because we can't assume that everyone understands.
Well, once again, I would like to thank our two speakers today, Shercole and Dennis. You definitely helped enhance our conversation around data and gave us so much more to think about as we continue this conversation with the field. And thank you too, as well, to all of you who attended today. Your conversation in the chat and your questions were also awesome and highly enhanced our conversation. Please do consider continuing to connect with us on these issues. We look forward to seeing you at future conversations about data reform and beyond, because we talk about a lot of issues at the Alliance. So we hope to see you again. Thank you and have a good afternoon.
Thank you.